please make sure that you benefit the little that you can. Like most of the people, you discover that most of the things we go through are things that you come across in the exam and also in the test, as observed by just the ended physiology test. For anatomy, I'm assuring you the same thing. Okay, so in today's class, I'll look at the heart. I'll look at the heart and its blood vessels, what the heart is made up of, its function, and some important things that we need to take note of. So the first thing I'll look at is some 5 facts of the heart, some 5 facts that you need to know about the heart. The 5 interesting facts about the heart. One important fact we can look at the heart is that the heart is capable of beating about 100,000 times in a particular day. The heart is capable of beating about 100,000 times in a particular day. So meaning from 00 to 00, you find that the heart is capable of beating 100,000 times. The other thing that you need to understand is that each minute the heart is capable of pumping 1.5 gallons of blood. So that's one other important fact about the heart, of the important thing that you need to take note as a medical student. Okay, the other thing is the heart has valves, and when you talk of these valves are just like a size of $1 coin. So if you have a coin like that, then you cut it into half, it's just representing a size of a valve. If you look at the valve, let's say this is a blood vessel there. So you need to understand that if this is, you're going to have somewhere there. The valve, when this and goes to this region, this not the presence of valves. These valves can be observed in the region, in the 4 regions of the heart, the 4 chambers, the left atrium and the left ventricle. They are being separated by a what? By a valve. The main reason there is a valve there is just to prevent the blood from flowing back. Then we have the largest heart in the world, which is that of a whale. A whale is just an organism which is found in water. So the largest heart is recorded for that particular organism or animal. Okay, so I've just looked at the 5 facts about the heart, 5 interesting facts about the heart, but let's quickly look at the function of the heart. So when you talk of the heart is a very, very important organ in the body which plays a very vital role in making sure that it generates the what? The blood pressure. And this blood pressure is due to the what? To the contraction and relaxation of the heart. This is why we are able to listen to the heartbeat. It's due to the relaxation and the contraction of the what? Of the heart muscles, which are making the what? The myocardium. So you need to understand that this heart is just generating that pressure, and that pressure is making sure that the blood, and that blood will go to supply what? To supply oxygen. We also need to understand that this same heart, it's pumping that blood, and that blood is going to correct the carbon dioxide which has been generated by these tissues, so that that carbon dioxide can be gotten rid of. Okay, so the heart generates the blood pressure, and this blood pressure is due to the contraction of the what? Of the heart. And this blood pressure, it is the one which is leading to the what? To the flow of blood in the human being. Okay, all right, I'm sure my okay, all right, so there we go. The other function is that the heart is capable of separating the cardiovascular system into two components. We have the pulmonary and we also have the systematic. This will be explained later on in detail, step by step. Then the other thing is that the heart makes sure that the blood flows in one direction. This is due to the presence of the valves of the heart. That is the reason why when there is a complication in terms of the valves, you find that such a condition is not life supporting, because the heart is made in such a way that the blood needs to flow only in one particular direction. Then, like I said, the heart, because through its contraction and relaxation, the heart is creating that blood pressure. That blood pressure is regulating what? The amount of blood to go to a certain particular tissue. It is the one which is determining how much blood needs to go to the lungs, how much blood needs to go to the lower limb, how much blood needs to go to the upper limb, depending on on the metabolic reactions that are taking place. For example, you find that when someone is exercising, that simply means that the particular tissues which are playing a role in that exercise, they need a lot of oxygen. Okay? As a result, the heart will try hard to make sure that it pumps as fast as it can to make sure that the blood is being supplied to the particular tissue. This is totally different how the heart beats when someone is resting, when someone is sleeping. How the heart beats is totally different from how the heart beats when someone is doing exercise. Even the body, the position of your body, it also determines how the heart will do what? Will pump. In short, what we are just trying to say is that the heart is regulating the amount of blood pressure or the amount of blood to be delivered to a particular tissue or organ. What have I just said here? What I've just said here is that, one, the blood generates the blood pressure in one particular direction. Please make sure that you follow up and make sure that you ask as many questions as you can. Okay, do you have any question from here, from what I've just explained? Do you have any question, men and women, children of God, doing grade 9 or primary education? They're able to relate this. But this is not interesting for your level as intellectuals. So here's what we need now to look at. The first thing we need to look at is the feature of the heart. So the heart is made up of two parts. The heart has the apex, which normally faces inferiorly on the inferior side of your body. So the heart has the apex, and this apex is normally on the inferior side of the body. And this apex, it is in contact with the diaphragm. As a result, it's forming the diaphragmatic surface. So the diaphragmatic surface, it is the one which is forming the inferior side of the heart. And this inferior side of the heart is made up of the apex. This point is an exam point. For those who go through exam question, you find that my statement, you find it somewhere. So it's up to you to keep it or leave it. So the apex, it is making the inferior side of the heart. And this apex is in contact with the diaphragm. The diaphragm, it is on the inferior side of the heart. Remember that the heart is found in the middle mediastinum. And you need to understand that it is having the apex side, which is on the inferior side, and this apex side, it is in relation with the diaphragm. So a question comes and they'll ask you, which of the following is on the inferior side of the heart? They won't mention the apex because you can relate. And your answer should be, it is the what? The diaphragmatic what? Surface, which is in contact with the apex. The other part which we need to be interested in is the base. Remember, we have the apex, we also have the what? The base. By the way, when you talk of the apex, one thing you know by the left ventricle. Okay, so in this picture you can see there, this is just the apex, and then that side you can see the base. So you have the apex and the base. Take note of every point. Take note of every point, please. All right, let me quickly go on the next section. I don't know if there is any question about what I've explained. If there is, understand, it is the heart. Okay, so let me quickly move on. The next thing, I'll just specifically look at the apex. I'll specifically look at the apex. One, the apex is formed by the inferior lateral part of the left ventricle. Inferior lateral of the left ventricle. This is the part where mostly the apex is formed. Take note of that. Then it lies on the fifth intercostal space. It lies on the fifth intercostal space. That's an exam part. Then this apex is usually 9 centimeters from the what? Median plane. This median plane is also known as what? The sagittal what? The sagittal plane. Remember the anatomic position, the sagittal plane, you need to understand that it is also known as the median what? Median plane. Take note of that. Then when you talk of the heart, the apex, this is where the sound of the mitral valve can be what? Can be mostly be heard. Remember, this is the sound of the mitral valve. There are also other valves, and from all these valves, you need to know where you can place to hear the beat of those valves. I'm going to explain later on in this same class. Make sure that you follow. Points to take note of. One, it is forming the inferior lateral, but you won't find this inferior lateral. Instead, in most cases, you find that they will just say what? The inferior surface. And this inferior surface, it is forming the what? The diaphragmatic surface. Diaphragmatic surface. Matic surface. Meaning it is in contact with the what? The diaphragm. But please, you might not done well in physiology. Do well in anatomy. It is a little bit okay. So let me repeat this part. I think my what? My slide had to pause. One thing I've said here is that the apex is formed by the inferior lateral. Okay? But in the exam, this inferior lateral, you won't see it. Instead, you either see a word of inferior, or you say the diaphragmatic surface. That is very important. And then the thing that you need to understand is that the heart, the apex of the heart is mostly occupied by the what? By the left ventricle. And it is this apex of the heart which is found in the fifth intercostal space. But for someone to locate the fifth intercostal space, they need to first locate the what? The second rib. And that has to be understood when you guys know the parts of the what? Of the sternum. I'm sure you have been explained when you talk of the sternum. Okay, the other thing is the base. These are things that you need to understand. The base is just opposite the what? The apex. Opposite the apex. Okay, that's one fact about it. And this base is mostly occupied by the what? By the left atrium. The base is mostly occupied by the what? By the left atrium. We know that the right atrium is related to the base, but this base is mostly occupied by the what? The left atrium. Take note of that. Take note of that. Meaning, any injury that is taking place on the base of the heart, the chamber that is likely to be injured is the what? Is the left atrium. Take note of that. Okay. The other thing is, this base, it faces the body of the vertebra T6 to T9. It faces the bodies of vertebra T6 to T9. Take note of that. The other thing is that this guy, it normally extends superiorly, meaning it moves upward to go and meet or to move towards the what? The pulmonary what? The pulmonary tract. Remember that the pulmonary tract and the aorta are related in such a way that there you can find what? You can find the what? The transverse sinus. You can also know that the pulmonary tract and the aorta are linked or connected together by what? I'll explain it later. It has gone. Data yaenda. So this is just something I've been explaining. This is just something I've been explaining about the base of the heart. One, the base of the heart, this guy, it's normally found on the what? On the bodies of vertebra T6 to T9. Okay, and then it moves to make sure that it goes and have a relationship with the what? With the pulmonary tract. And this base of the heart, it receives blood from the following. Please take note of that. The base of the heart, it receives blood from one, the pulmonary vein, and the superior and the inferior vena cava. Superior and inferior vena cava. Remember that the superior vena cava, it is normally formed by the what? By the anastomization of the what? Brachiocephalic vein. So the brachiocephalic vein, they are going to come together. That means that they are going to anastomize, and when they anastomize, they are going to form the superior vena cava. Take note of that, please. Take note of that. Yes, yes.
Would you please emphasize more on the...
There are two major important sinuses. There is one, the coronary, there is one, the transverse sinus, which is just behind the arc of the aorta and the pulmonary tract. These guys, you need to understand that just behind them, if you put your thumb or your finger, you reach at a point whereby you can't move to the other side of the heart. What's stopping you, or a membrane which is stopping you there from going to the other side, it is what we are calling the what? The transverse sinus. Then we have the what? The oblique sinus, which is on the apex of the what? Of the heart. So that will be explained later. Then the other thing that I have explained is it receives blood from the pulmonary vein, superior vena cava, and the inferior vena cava. I've literally spent few minutes to talk about the superior vena cava. And I've said that the superior vena cava is made by what? By the brachiocephalic veins through the anastomization. When we use the word anastomize, it means that they are meeting. Bifurcate, separating. Anastomize, meeting. So when the right and left brachiocephalic veins come together, they are going to form the what? The superior vena cava. All of these, they are coming together to supply the what? The base of the heart. I think that's what can be said, unless if there are more questions. Okay. Any question? They are exposing you to such treatment. They want to reduce the numbers. So please, let's quickly look at the location of the heart. Where is the heart? So one thing we need to understand that the heart is found in the thorax cavity between the two lungs, and this place is known as the what? The mediastinum. Here the statement is just saying the mediastinum, but you need to understand that this is the middle mediastinum or the middle mediastinum. The exam teach you to say, no, where is the heart located? And you'll be like, mediastinum. Even someone who doesn't study, you'll be able to know that the heart is on the mediastinum. But this mediastinum is divided into the inferior, the lateral, and also the what? The middle. So you need to know that the heart is found in the middle mediastinum. And this means that it is just behind the what? The sternum. There is a bone, which is the what? The sternum. Okay? Then you need to understand that it is found between the second and the sixth rib. I'm going to be taking my time, not in a hurry. Unless those who are in a hurry, I'm sure you log out, but I'm not in a hurry because anatomy is the next test to come. Lies between the second and sixth rib. What does this mean? This simply means that if anything was if someone was to be stabbed between these ribs, especially on the left side of the heart, expect the heart to be what? To be damaged. Now the question is, which side of the heart is going to be affected? And the answer is that it is the what? The right ventricle. The right ventricle, it is the one which is mostly exposed on the anterior side of the heart. Meaning, on the chest side, the ventricle which is mostly exposed, it is the right ventricle. Any stabbing between the second and sixth rib, you need to expect the right ventricle to be injured. Why? The right ventricle is the one which is mostly exposed. Okay. Then it is between T5 to T6, T5 to T8, and then you can talk of it is on the left or the midline. Like I have said, the heart is not just on the middle, but it is a little bit on the left side of the midline. Then the apex of the heart, like I have said, is located on the fifth intercostal space. On the fifth intercostal space. Do we have question on this part? Any question, children of God? Any question? Okay, no question. Please ask. If you have a question, ask. No one is coming to save you. Please ask. Okay. The heart anatomy. Okay. When you talk of the heart, it is approximately the size of your fist. But this varies, okay? this varies. It doesn't mean that everyone has the size of the heart approximately to the size of the fist. No, it varies depending on the what? The age, the size, and the condition of the what? Of the heart. Some people are sick. Do not expect them to have a heart which is according to the size of their fist. Okay? Then, when you talk of the location, it has the superior surface of the diaphragm. Here, a lot of you, you won't understand this point. And that's where people will get lost. I've said, it is located on the superior surface of the what? Of the diaphragm. That means that the diaphragm is on the inferior surface of the heart. The heart is located on the superior surface of the diaphragm. That simply means that the diaphragm is on the inferior side of the what? Of the heart. Then it is located under the rib cage. Remember, it is between the what? The second to sixth rib. Between the second and the sixth what? Sixth rib. Okay? And then this is between the what? The lungs. And this region is known as what? The medial or mediasternum. The mediasternum. That's where you need to expect the what? The heart. It can be the thorax region, the thorax cavity. Yes, we know that. Specifically between the lungs. And when you talk between the lungs, then you are talking about the mediasternum. But the mediasternum has different regions such as the inferior lateral and the medial. So when you talk of the heart, it is in the medial side of the mediasternum. And it is automatically on the left side. It is automatically on the left side. There is the right side, yes, but the right side is too small. Please take note of that. Then I want to talk about the anterior. It is anterior to the what? To the vertebral column. This anterior side to the vertebral column, you need to understand that the anterior side of the heart is mostly made up of what? The right ventricle. The right ventricle, it makes majority of the anterior side of the heart. All right. I think this has already been explained. The only thing I can explain right now is about this important diagram. It looks easy, it looks simple, but everyone needs to know this. You should be able to identify what this blood vessel is, what that blood vessel is, and what that blood vessel is, what this blood vessel is. Okay, you can look at this guy. This is likely to be what? The right coronary artery. Okay, you can talk about this. This is the left coronary artery. The left coronary artery will split into two sides. There is the circumflex and there is also the what? Interventricular artery, which is the anterior intraventricular artery, which is moving in the what? In the interventricular sinus or groove. Okay, then this right coronary artery will give rise to the what? To the marginal artery. So you need to take note of such. And all these parts, you need to understand them. What this is, what that is, what that is, what this is, and many other stuffs, which will be explained later on. Okay. So this is just something that I've already explained about the anatomy of the heart. Anyone is capable of going through this, and you need to understand. Covering of the heart. I know most of you, some people have left. Every point is important. Anyway, let me move on. So, covering of the heart. The heart is covered by a membrane-like structure which is known as the pericardium. The heart is surrounded or protected by a membrane-like structure which is known as the what? The pericardium. It has two layers. This pericardium has what? Has two layers. The pericardium has two layers. The first layer, it is the fibrous layer. The other layer, it is the serous layer. The serous layer, it is again divided into two types, where you have the parietal, which is in relation with the what? With the fibrous layer, and you also have the other layer. We look at that. So the pericardium is the one which is covering the heart, and this pericardium, it is a double-walled sac, and this pericardium is formed by two parts, the superficial fibrous pericardium and what? The deep two serous layer. It is between the two serous layer, that's where you can find what? The pericardial cavity. The pericardial cavity is where it is the fluid-filled portion of the pericardium, and this pericardium is helping the heart to move freely without any friction. Because if the heart was subjected to friction, you need to understand that it may end up what? Any question? The way it's called, you find that people are sleeping.
Look, I have a question. On the pericardium, whatever, yes. You said that it has two layers, ka?
With the what? The heart. It is the one which is protecting the heart. Okay? And this visceral, it is the one which is also forming we have pericardium, which is protecting there. We also have the walls of the heart, which we have the epicardium, we have the myocardium, and we also have the endocardium. So the visceral pericardium, which is protecting the heart, which is forming the lining of the heart, it is the one which also forms what? The epicardium. Then we have the other one, which is the parietal. The parietal is the one which is in relationship with the fibrous pericardium. The upper part, and then the visceral, which is also known as the epicardium, is the one which is protecting the surface of the heart. An exam question is there. Then in between them, there is a fluid, which is the fluid cavity, and this cavity is known as the what? Pericardial cavity. Have you understood that?
Yes, Doc, thank you.
You are welcome by God's grace. This which I've projected, it is something which your lecturer has not put in their notes. And this is something you need to expect in your gross anatomy test. So if you look at this guy is the parietal pericardium. The parietal pericardium is the one which is in relation with the what? With the visceral or with the fibrous pericardium. Then you have the visceral pericardium, which is around the what? The heart. In between them, here, you have to find the what? The pericardial cavity. Both the parietal and the visceral, both of them are serous pericardium layer. Is that okay? Is that okay?
Yes, Doc.
Okay. The visceral pericardium, it forms one of the walls of the heart. The heart has three walls: epicardium, myocardium, and endocardium. Endocardium is the innermost. The myocardium is the most muscular. And the epicardium, it is the thin-like layer which is formed by the visceral epicardium. So in an exam, they can ask you which of the following forms the epicardium layer of the heart. So you need to know that it is the visceral. If you research, Google, or some sources, they'll tell you parietal, some sources they'll tell you visceral, but the accurate one is visceral. Okay, all right. I'm sure I've just shown the serous part. Remember, don't forget about the pericardial cavity umu mukati umu, here in between. They'll point here. They'll tell you label X. Here is the cavity, also the cavity, layer. You have the fibrous layer. This is what the fibrous layer of the heart. If you look at this is where the apex of the heart was. This is where the apex of the heart was. Oko. This is the apex of the heart. This is just the diaphragm. I can see it from there. This is one that apply here it protects